Hello, today's discussion is on rotavirus vaccine, typhoid vaccine and Japanese encephalitis vaccine. I'll be discussing these vaccines in detail, including the ones which is included in the National Immunization Schedule. Let's start with the rotavirus vaccine. So before we go to the vaccine, we have to know that natural infection with the rotavirus does not protect against reinfection. So vaccination is very, very important. Rotavirus vaccines are live attenuated oral vaccines, and this prevents children from severe diarrhea. Rota, the word rota comes from Latin word which means wheel. It looks like a wheel in electron microscopy, so it gets the name rotavirus. Belongs to genus Rotavirus, family Rotaviridae. And rotavirus was discovered in India in 1977, Christian Medical College Hospital, Vellore, where they detected rotavirus in the stools of less than 2-year-old children who were suffering from acute diarrhea. Rotavirus infection is very contagious. It spreads through fecal-oral route. When the water gets contaminated or food gets contaminated with the feces of infected person, this disease spreads, and sometimes even with the body fluids it can spread. The most common age group for rotavirus infection is 3 months to 35 months. The virus can live for hours on hands and even longer on hard surfaces. Before we move on to the vaccination, we have to know a little bit about the virology of the rotavirus. Rotavirus has an 11-segmented double-stranded RNA genome surrounded by 3 protein shells, a core inside, an inner capsid and an outer capsid. RNA gene segments encodes for structural viral proteins and non-structural viral proteins. The structural viral proteins are 6 in numbers: viral protein 1 till 4 and viral protein 6 and viral protein 7. And non-structural protein is also 6, that is NSP, non-structural protein 1 to 6. And in the vaccination, viral protein 4 and viral protein 7 plays the main antigenic roles. More than 6 lakh children die due to rotavirus infection, and approximately 2.4 million get hospitalized annually because of the rotavirus disease, that is mainly the acute diarrhea. So, in April 2009, WHO recommended the global introduction of this vaccine in National Immunization Program of developing countries worldwide. So, by 2026, at present day, approximately 132 countries have already introduced rotavirus vaccine in their national immunization program. The development of the rotavirus vaccine. It uses the major structural protein, that was VP4 and VP7, for the development of the vaccine. So the VP4 is the P antigen capsid spike protein, and VP7 is G antigen glycoprotein. So these are used for the development of the vaccine. Currently licensed vaccine for use is Rotarix, which is a monovalent vaccine, and Rotatec, which is a pentavalent vaccine. Pentavalent means 5 strains of the rotavirus vaccine is present against 5 strain, and monovalent is against 1 strain. Let's see the WHO pre-qualified vaccines for rotaviruses. So number 1 is Rotarix, monovalent live attenuated vaccine. Here you give 2 doses, and this manufacturer is GlaxoSmithKline, and this is the vaccine that is being used in many countries including Nepal. Rotatec is a pentavalent live reassortant vaccine. Reassortant means virus created by mixing genetic segments from 2 different viruses or 2 different strains. And this is given in 3 doses. Manufacturer is Merck. Rotavac, that is again a live attenuated. You have to give 3 doses, and the manufacturer is Bharat Biotech India. And Rotacil is pentavalent live reassortant vaccine. You have to give 3 doses here in this vaccine also, and the manufacturer is Serum Institute of India. So 1 and 2, Rotarix and Rotatech, is practiced in many countries. Now come to the rotavirus vaccine in Nepal immunization program. In the Nepal National Immunization Program. So Nepal has introduced rotavirus vaccine in July 2020, and the vaccine used is Rotarix. This is a monovalent live attenuated vaccine which is derived from rotavirus strain of G1P8. G1 strain has VP7 antigen type 1 and P8 strain has VP4 antigen type 8. The dose is 1.5 ml and the route is oral, so it is a oral suspension. Schedule, you give at first dose at 6 week of age and second dose at 10 week of age. Important thing regarding this vaccine is first dose should be given before 15 weeks of age, and the series, that means the second dose, should be completed before 24 weeks. Rotatech vaccine, another rotavirus vaccine which is being used, is a pentavalent live reassortant vaccine. It contains 5 strains expressing the VP7 and VP4 antigens, and the strains are G1, G2, G3, G4 and P8. Dose 2 ml and route is oral. Schedule 6 weeks, 10 weeks, 14 weeks, 3 doses. And again important is first dose should be given before 15 weeks and all doses should be completed by 32 weeks. Now the adverse reaction of rotavirus vaccine. The common ones are diarrhea, vomiting, loss of appetite, fever, flatulence, abdominal pain. Less common is irritability, mild cough or runny nose, and mild abdominal discomfort can occur. Rare but serious complications are intussusception, which occurs usually 1 week after the first dose. Contraindication of rotavirus vaccine. The absolute contraindications are severe allergic reaction or hypersensitivity to any components. And if a child has a severe combined immunodeficiency disorder, if there is a history of intussusception or there is a risk of intussusception, that is also contraindication. And children more than 8 months, you will not give the rotavirus vaccine. Temporary contraindications are moderate to severe acute illness, persistent vomiting, severe diarrhea and high fever. Temporary contraindications, here the vaccine is deferred. After they recover from this illness, you can give the vaccine. Next vaccine is typhoid conjugate vaccine. This is the vaccine which we are giving in the immunization schedule, but there are other typhoid vaccines also. So I'll discuss all the typhoid vaccines, including the one which is in the immunization schedule. Before we go to the vaccine, just know how typhoid can be avoided. It can be avoided by avoiding the risky food or drink, because this disease is again occurring through the fecal-oral contamination. So the food, drink should not be contaminated. Then use only clean water, because water is one source for typhoid fever. Ask for drinks without ice unless you know where it is coming from. So ice can be a source for typhoid fever. So you have to be careful while using these things, especially when you are eating outside. And only eat food that have been thoroughly cooked. And avoid raw fruits and vegetables. This is very important. And then finally, to avoid typhoid fever is by getting vaccinated. Now let's see the different types of typhoid vaccines. First generation is inactivated whole cell vaccine. Second generation is live attenuated oral vaccine, oral typhoid vaccine. Another second generation is VI polysaccharide vaccine. Third generation vaccine is VI polysaccharide conjugate vaccine, and this is the one which we are practicing, which we give in the routine immunization schedule of the country. Fourth one is paratyphic conjugate vaccine. Okay, now first generation typhoid vaccine is a whole cell typhoid vaccine which is inactivated vaccine, and this was introduced in 1896, but due to its side effects this vaccine was eventually discontinued, and when you give this vaccine you had to give 2 doses 1 month apart. Then they developed the second generation vaccines. In this, TYA is TY21A, that is a live attenuated typhoid vaccine which is given orally. VI capsular polysaccharide vaccine is another second generation vaccine. This is given injectable route. It is an injectable subunit vaccine. And third generation vaccine is VI polysaccharide conjugate vaccine, and this is in practice. Fourth generation is paratyphi conjugate vaccine. Now let's see the division of the new generation typhoid vaccine. So the new generation typhoid vaccine can be parenteral, can be oral. This oral TY21A vaccine is not available, so usually not practiced or not given. Parenteral VI polysaccharide vaccine, this was the second generation vaccine, and then this is also excluded or this is not used these days. VI polysaccharide conjugate vaccine, this is the one, third generation vaccine, so this one is used. And this again can be 2 types. One is conjugated with the Pseudomonas aeruginosa exotoxin A, but this is not available, so not given. And another is conjugated with the tetanus toxoid, and this one is available and this is practiced. So we give VI polysaccharide conjugate vaccine which is conjugated with the tetanus toxoid. Okay, whom to vaccinate? The recommendation by different groups. So number 1, Indian Academy of Pediatrics. It recommends VI polysaccharide conjugate vaccine to be given to children less than 1 year, preferably 9 months to 12 months, and it can be given to age as less as 6 months old. And it recommends to practice this vaccine in the routine schedule, to introduce this vaccine in the routine schedule vaccine. And Disease Center for Disease Control and Prevention, CDC, recommends to vaccinate against typhoid vaccine for all, adults, children, everyone. And World Health Organization, WHO, they have mentioned target group or target population for this vaccine. So the target population are people traveling in high risk areas, that is the endemic areas, people in refugee camps, microbiologists, sewage workers, and also all children. They should be vaccinated by typhoid vaccine. Let's see the VI capsular polysaccharide vaccine. This is highly purified antigenic fraction of VI capsular polysaccharide antigen of Salmonella typhi. Each dose contains 25 microgram of purified polysaccharide, and this is given intramuscular or via subcutaneous route. It should be stored at 22 plus 22 plus 8 degrees Celsius. Since this is a pure polysaccharide vaccine, some disadvantages were seen. So number 1 disadvantage, this is poorly immunogenic. Less than 2-year children, they do not respond to this vaccine, so it is not of benefit for this age group. No booster effect was seen. The response was not good with the booster doses, and then poor quality of antibodies production was noticed, and then hyporesponsiveness to repeat doses, that is to booster doses. It was not responding very well, so this vaccine is not practiced in the present days. This VI polysaccharide vaccine, you could give only to children more than 2 years, and then give in single dose with booster requiring every 3 years. Then oral TY21A vaccine is another vaccine which can be given to children above 6 years only, because less than 6 years they do not respond well. And dose 1 capsule day 1, day 3, day 5. Here also boosters are recommended annually. So both of these vaccines, they are giving protection 50 to 80%. Then comes the typhoid conjugate vaccine, which is the vaccine used in the schedule. It protects children against typhoid fever. and this is conjugated, the VI polysaccharide antigen is conjugated to a protein carrier. So when you do this, it produces stronger and longer lasting immunity. Even in children less than 2-year-old, you can give this because they also respond to this vaccine. And VI polysaccharide conjugated with tetanus toxoid protein is being used. Now the differences between typhoid conjugate vaccine and the older polysaccharide vaccine. Age of use, typhoid conjugate vaccine can be used from 6 months. Polysaccharide vaccine can be given only after 2 years of age. Immunity is stronger and longer in case of conjugate vaccine. Polysaccharide vaccine, the immunity is shorter and then weaker also. Immune memory is present with the typhoid conjugate vaccine, whereas there is no immune memory in older polysaccharide vaccine. So typhoid conjugate vaccine is much beneficial for the vaccination. Now the WHO recommendation for typhoid conjugate vaccine for the National Immunization Program. So according to Nepal National Immunization Program, the administration is at age 15 month single dose. The route is intramuscular, site is anterolateral thigh for the infants, deltoid for the older children. And dose is 0.5 ml. And booster dose, currently routine booster is not required. Protection with this vaccine is 5 years or sometimes even longer. Side effects, there are hardly any side effect of this vaccine. Some common side effects are pain, swelling at injection site, mild fever, irritability. Very rarely allergic reaction can occur. And contraindication is severe allergy to previous dose, but this is very rare. So it is very safe vaccine. Now the third vaccine is Japanese Encephalitis vaccine. Japanese encephalitis occurs mainly in Asia. This is an important cause for viral encephalitis. Viral encephalitis is a very life-threatening and serious disease of the CNS because there are many mortality with a viral encephalitis. So the vaccination against this disease is very important. The recommendations or indication for JE vaccine is travelers to endemic regions, research lab workers, JE or people who are living in the endemic areas, all people, they are supposed to get this vaccine. So children in endemic areas, all children should get this vaccine. And rural agricultural areas with rice field and pig farming areas, since this JE is spread through via mosquito, the Culex mosquito, so this rice fields and pig farming areas are the risky zone. So if these areas are more, they should also be vaccinated. During outbreak, control campaigns are given. Now the Japanese encephalitis vaccines in detail. There is first generation JE vaccine that is inactivated. So number 1, first generation JE vaccine, inactivated mouse brain derived vaccine. This is grown in mouse brain tissue, then is inactivated with formalin. This is an older vaccine, but due to its lot of side effects, this is phased out and not used in present day. Then they developed the second generation vaccines, which is produced using the modern cell culture or recombinant technology. According to this, there are 3 types. A, live attenuated vaccine, that is SA14-14-2 strain. The principal strain is SA14 and this is cultured, recultured, and the final strain is SA14-14-2. This is produced in primary hamster kidney PHK cell culture and most widely used vaccine in Asia. You give single dose of this vaccine, and some countries they practice booster dose also. Second is inactivated, second generation second vaccine is inactivated varicella vaccine, which is derived from IC51 strain. This is grown in varicelles, monkey kidney cell line, and then it is formalin inactivated. You need to give 2 doses of this vaccine, first dose on the first contact and then after 28 days. And second generation, third type of vaccine is live recombinant chimeric vaccine. This is licensed in Australia. Japanese encephalitis vaccine in Nepal National Immunization Schedule. Here we use live attenuated JE vaccine strain SA-14-14-2. This is a freeze-dried powder coming in a vial. So here you need a solution. So solution or the diluent is phosphate buffer solution 2.5 ml, which comes along with the vaccine. So you need to mix this powder in this solution, and per vial they give 5 doses. So per vial you can vaccinate 5 children. Dose is 0.5 ml, and the site is anterolateral aspect of the thigh in case of children, deltoid in case of adults. And the route of administration is subcutaneous route. Storage +2 to +8 degrees Celsius, and the efficacy of this vaccine or protection is 98 to 99%. And you're supposed to discard this vaccine 1 hour after reconstitution. Immunization schedule we give at 12 months of age. Single dose and no booster is given in Nepal. Some countries they practice booster also in the national program, and booster is given at 16 to 24 months. Now the adverse events or adverse reactions: minor pain, redness, tenderness and malaise within 24 hours can occur. Minor allergic reactions in the form of sporadic rash can occur within 24 hours. Mild transient fever can occur within 1 to 2 weeks after vaccination. Rare but serious complications are anaphylaxis, urticaria, purpura. Contraindications: some relative contraindications are severe acute illness with fever, severe chronic illness with acute onset. It is not recommended below 6 months of age. Pregnant ladies should not be getting any live vaccines. And immunodeficiency disorders or any individual who is on the immunosuppressive therapy. And then encephalopathy, uncontrolled epilepsy, progressive diseases of the nervous system are some relative contraindication of this vaccine. Absolute contraindication is if there is a severe allergic reaction, anaphylaxis to the previous JE vaccine, then you should not give the vaccine. Caution should be taken if the individual with the family or individual himself has a history of convulsions, or if there is some chronic diseases, then you take caution, or with precaution you can give. Even with the relative contraindication, many times with precautions you can give the vaccine. Okay, thank you. Hope this class was useful for you all. Next class I'll take 2 more immunization class. So remaining is optional vaccines and some vaccines in the special situations. Even MR vaccine, pneumococcal vaccine. So these are remaining. Those few vaccines I'll discuss over next 2 classes. Thank you.